Thank you, Tina, and good afternoon, everyone. Before I turn it over to Dr. Strang, I want to take a moment to acknowledge the 2 deaths that we are announcing today, as well as the deaths that were reported over the weekend. And I want to tell those families how sorry I am for the loss. It's tough enough at any time, but having to deal with this loss at a time of COVID adds extra distance and extra heartache. And on behalf of our province, I want to acknowledge your pain and offer our condolences. I also want to acknowledge today is the National Day of Mourning for those who've lost their lives as a result of a workplace injury or illness. Although many of our workplaces are closed right now, we want to honor those who've lost their lives or injured on the job and recommit that when our economy does open, that the safety of all of our workers will be our #1 priority. Dr. Strang, I'll ask you to bring us up to date.
Thank you, Premier. Good afternoon, everybody. And today I'm sorry to announce 3 deaths. Sorry, Premier, it's 3 deaths. So 3 additional deaths due to COVID-19, and they're all residents of Northwood who passed away yesterday. We now have had 27 of our fellow Nova Scotians who have died as a result of COVID-19. We also have 15 new cases of COVID-19 to announce today, bringing the total number of confirmed cases in Nova Scotia to 915. We currently have 12 individuals in hospital, 3 of those in intensive care. 522 people have recovered, which is good news. That's about 57% of our overall cases have actually recovered, which is good news, and we need to be talking about that as well. We have 26,902 Nova Scotians now have been tested and have been found to be not have COVID-19. We have 10 licensed long-term care facilities and unlicensed seniors facilities that have had 1 or more cases of COVID-19, and involving a total of 218 residents and 95 staff. The majority of both residents and staff, of course, are a part of the Northwood outbreak. Yesterday, the QE2 lab processed 483 lab tests, well below their capacity, and we are in an actually envious position to have a very strong testing capacity, and we are looking at other ways that we can enhance our testing to understand more about the impact of COVID-19 and how it may have spread within our province, and you make full use of our lab capacity. And so we're actively exploring those possibilities. But I also want to take the opportunity to remind Nova Scotians that anybody who may have COVID symptoms, it's important that we get you tested as quickly as possible. So if you have 2 or more of fever, new or worsening cough, headache, runny nose, or sore throat, if you're able to go online, do the online 811 assessment and get further direction. If you don't have that online ability, calling 811 and they'll do the assessment as well, and you'll get further direction. So anybody who thinks they may have those symptoms, do the assessment because we want to test you as part of our ongoing work. Early identification of cases, close follow-up of cases and contacts is a critical part of our COVID response. I want to talk a little bit just about people are hearing other provinces and how they may be moving a plan to lift restrictions. So let me just talk a little bit about where we are at on that with Nova Scotia. Certainly want to start by acknowledging that this isn't easy, that the public health measures we have necessarily put in place have and are having significant impacts on families, on communities, on businesses. So it's important that we all recognize that, but also recognize the necessity of why we have done what we are doing. There are discussions as a reference that people I'm sure are aware of, that discussions across the country, certainly at my table with my Chief Medical Officer of Health colleagues, about how can we safely and slowly start to lift these restrictions. Every province is doing that work, guided by a nationally produced framework that's coming from the Special Advisory Committee where the Chief Medical Officers of Health all sit. We are using that national framework. We are working on a plan here in Nova Scotia. We've started that conversation last week and continued it today within government. But this is not something we can rush. We still have a significant amount of virus activity here in Nova Scotia. It's absolutely premature for us to open things up significantly at this time or even in the next couple of weeks. But we are looking at how we may start to take some initial steps in that direction. But it's important that people need to understand that no matter, even if you're hearing something from another province or another country, that the decisions that we need to make and will be and necessarily have to be based on Nova Scotian epidemiology and other local data. Other provinces are making decisions based on their information, but this is not a common or consistent, or the pandemic is not playing out across the country in a common or consistent way. And so we have to have a plan that works and is appropriate for Nova Scotia. As we develop that plan, once we're comfortable with it, once we have the right decisions made, then we will be able to start to share that. But it's important that Nova Scotians understand that this will be a slow and deliberate and phased process. We're going to take our time to do this so we can get it right. We'll always be watching to have the impact and have we actually created an increased ability for the disease to transmit. And we're going to be, it's far better in my mind and in the Premier's mind to be slow in this and minimize the chance of having to tighten things back up again, rather than going out fast and then realizing, oh, now we have more disease and we have to re-implement restrictions. So this will be a very phased and slow process. Any of the steps we take are going to be done thoughtfully and carefully. We have time to do this and consult, whether it's the education system, whether it's in the hospitality sector, whatever. We have now time we can actually work with groups and businesses and organizations and get their input about how we can best do this. But at the end of the day, it's going to be all about making sure we do things in a safe and planned manner. The other thing that people have to recognize is that even as we start to lift restrictions, and if people have looked at other provinces' plans, they will have seen this, we're going to have to collectively stick with the basic requirements around social distancing, minimizing the chance of groups of people, especially large groups of people, getting together, as well as proper hygiene, hand washing, not touching your face. Those are going to be in place for months ahead of us. And because they're going to be really important that even as we open up, whether it's the outdoors, whether we start to open up other types of businesses, that those will only be able to operate safely if they can accommodate and people are sticking with the rules around social distancing, around maximum numbers if that's appropriate. So I think we just need to understand that the things are going to, as we talk about returning back to normal, what actually normal is actually going to look quite different for a significant length of time. This virus is with us for a long period of time. And we have to make sure we don't give the virus a chance to get a stronger foothold, even as we try to lift some of the restrictions. We will continue to remain focused on protecting those who are most vulnerable to severe COVID-19 illness, and it's those living in shared living environments, such as long-term care facilities, homeless shelters, as well as our healthcare workers and other essential workers who continue to go to work and put themselves at risk. So we need to protect those individuals and those settings while we carefully lift public health restrictions to reduce the health, social, and economic impacts. It's all about a very fine balance here, and again, this will be done very slowly and thoughtfully and carefully. As I said earlier, I just wanted to focus a little bit again on some good, what I consider good news, that we have of our total cases, 57% of those. I was wrong. I said 52% earlier, but it's 57%, or 522 of our cases have had COVID-19 and have now recovered. So it's important that we share that good news as well with Nova Scotians. But while we share that, we also don't want people to think that we're completely in the clear. We are making progress. As we look at our epidemiology, we are seeing certainly limited spread in many parts of the province, reductions in community spread in others, but it is premature again to start to robustly lift our public health restrictions. So we will start to look at that, but do that very thoughtfully and carefully, because we know that Nova Scotia, that the virus is here. There is the potential for the virus in all parts of the province. There's some perception that it may be just exclusive to HRM, and while we have more virus activity in HRM, it is the potential for the virus in anywhere in the province. And if we let down our guard in any one community, there is the potential for the virus to then resurge and put people at risk. So we need to continue to follow the public health directives and do that not just for ourselves, but as I said before, for our neighbors, for our friends, for our colleagues and parents, and for our and people in our communities who themselves go to work and put themselves at risk. So we just have to, and I think the key thing people need to take home is that, again, I have to emphasize that sticking with good hygiene, minimizing social interactions, social distancing, sticking mostly with the people that you are, that within what I call your home unit, people that you live with, that's going to be important and necessary for a long time to come. So we'll come forward with some more details of this plan soon, but I think we wanted to make sure that Nova Scotians understood what they can expect in the coming weeks and months. I'm just going to finish. I have a new friend on email, Sawyer Burke, who's an 11-year-old Nova Scotian, who's emailed me a number of times saying he listens faithfully to the Premier and I, and he follows our advice, and he's using that advice to actually educate his family and his community. So I just wanted to thank Sawyer for his example and his leadership about how all Nova Scotians can support each other.
Good job, Sawyer. Thank you, Dr. Strang. And as Dr. Strang pointed out, there will be a slow and steady approach to reopening our province. But I know there are many parents, teachers, and students wondering about schools and daycares. They will remain closed until the long weekend in May, and then we will reassess at that point. So with that, we will answer any questions you may have.
Again, a reminder, we will take one question, one follow-up from reporters on the phone in the allotted time that we have. Again, please ensure that your phones are on mute. We will start with Carolyn Ray from the CBC. Go ahead, Carolyn.
Hi there. My question is for the Premier, my first question. I just wondered if you can address this new funding program for the municipalities. I'm just wondering why it's a loan instead of a grant, and how municipalities will be expected to pay the money back, especially considering that this is going to be a long-term problem.
Well, they will be expected to pay it back. It's for many of them, it's for them to do property deferral. It's not to pay property taxes. They are deferring many, whether it's either individual residential property taxes or business taxes, which will be paid back later, and at that point they will repay that loan.
Go ahead, Carolyn, with your follow-up.
Can you talk more about why it's a loan instead of offering a grant, and what kind of interest rate they'll pay?
Well, the reason we did the borrowing for municipalities, many of them, we would have a better borrowing rate than they would if they went to lending institutions, and some may not qualify. So working with Minister Porter and the UNSM, they came up with a plan that made sense. It's a 3-year plan, which is outside of the typical municipal borrowing. As you know, if there is a shortfall in 1 year, a municipality needs to make it up the next year. We moved COVID outside of that. These are different circumstances. We put together a 3-year plan with payback from the municipalities that would not impact their current fiscal or the next fiscal. They would pay when their deferred property taxes are paid back. And it was a joint effort, and I want to thank Minister Porter and all the municipal leaders across the province who came to work with us, who want to support their tax base in the best way they can, and thank them for working with us to put this plan out.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. In regards to this idea of flattening the curve, you kind of addressed it, but I wanted you to give me a little more detail about where we are at this point in Nova Scotia. And, you know, despite the recent numbers at Northwood in particular, are we anywhere near flattening the curve in the province's long-term care homes?
So I think you can't look at the long-term care. You have to look at each long-term care home separately, because they are standalone facilities, and each one you look at the numbers separately. So right now we have 10 long-term care facilities or private seniors residences which have some level of activity. There's only one, Northwood, which has a large ongoing outbreak. The right steps are in place, but it'll take some time to get that under control. All our other care facilities that have had a small number of cases, and some of them may be towards the end of getting close to where we're able to say the outbreak is over. Once we have declared an outbreak, it takes 28 days of no cases before we can officially say the outbreak is over. So that's a month. So we're not there yet, but there are no other long-term care facilities where there's active, ongoing, significant transmission of COVID-19 at this point, other than Northwood.
Go ahead, Keith, with your follow-up.
Yeah, also to Dr. Strang, the province has announced a new mental health line to help deal with our current stresses, in particular, related to the recent shootings. I'm wondering, given some people's mental state, whether there's been any thought to at least opening parks so people can do a little more than simply walk around the block.
So we were well aware of some of the challenges, both physical and mental health, and the stressors that the restrictions are placing, and we were actively looking at, as I said earlier, opening up perhaps the people's options to be outdoors more is one of the things we're actively looking at as a part of our plan.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, I just wanted to...
A peak may not be just one very defined, distinct piece. The peak can be quite jagged with some ups and downs, and can go on for a period of time. So we have some early indications of that we're having decreasing community transmission of this virus, which is consistent with many other provinces. But we still have certainly lots of community clusters where we have this sporadic occurring of cases that are linked to each other, and so we were having that going on means that we are not yet able to start to lift the restrictions. The public health restrictions are there for a reason, to minimize the chance of transmission, and also to minimize the number of people that get together. So if you do have an event that the virus is being transmitted, the number of people that potentially could be impacted is small. So we still need, while we still have active ongoing transmission, we still need those restrictions in place. Even though we early signs that we may maybe have some encouraging news, but we need to follow that trend for the next few weeks, make sure what we're seeing actually is sustained.
Next, we'll go to Paul Legere, Radio-Canada.
Yes, my question is for the Premier. I know that I have asked this question before, but since there's been new developments and people in the community have started asking the same question, so can you precisely say whether or not you believe that there should be a public inquiry into the mass killings and the reaction and the way it was handled by the police, and what type of inquiry, if so, and to answer what questions exactly?
Well, as you know, there's an active investigation going on, putting together all of the pieces associated with that horrific weekend. The Attorney General will continue to monitor, look at what's happening, and a decision on that will be made at some time into the future.
Go ahead, Paul, with your follow-up.
Yes, this is for the Premier as well. Premier, do you believe that there should be a pandemic premium paid from some of the frontline workers, such as what is being done in Ontario and Quebec, in order to recognize the hard work that they're doing and maybe keep them in place as well?
Well, first of all, I want to thank all of the healthcare workers and all the essential service workers across our province who are continuing to ensure that the services that Nova Scotians need, quite frankly, and are there in place. I want to thank them for that. We've worked very hard to how do we support those families who are unemployed. who have no income coming in. While we recognize what's happening to our essential service legislator, we want to thank them. If you look at the national government's program, it really disqualified most of our healthcare teams because it didn't. The threshold was below what they are currently making. But I've said to the national government, if they want to make a top-up to healthcare workers in our province or to essential service people in the province, we would thank them for that.
Next, we'll go to Alicia Drouse from Global.
Thank you. This question is just in regards to the numbers at Northwood. Last week, you guys were saying that you're expecting numbers to rise as you continued to test everyone. I'm just kind of wondering, again, what we're seeing this week, what the numbers are telling us, and what we're expecting now.
So we now know in total we've had 199 residents at Northwood who have tested positive. I believe it's in around 78. I may be off by a few on that in terms of their staff. They pretty well finished up their broad sweep of testing, but we're now going to continue to test some of the residents whose initial tests are negative and just monitoring them. And so we expect we may see some more. The way this disease is played out, often residents with an initial negative test, when they're tested again in the next few days, actually turn positive. So we expect we're going to see some more positives, but I think with the broad testing that happened last week, that we've the bulk of the positive results that we're now aware of at Northwood. But we still have to focus. We have individuals there who need appropriate levels of care while they deal with their COVID infection. So we're by no means out of the woods yet for Northwood. We continue to move people off-site into the temporary long-term care facility. I know there's been a number moved over the weekend, and I think by the end of the week they're looking at upwards of 50 people being able to be moved out. Is the initial thinking here on early in the week, and that number then gives a lot of capacity to be more flexible within Northwood and to move people around within the Northwood facility.
Go ahead, Alicia, with your follow-up.
And just in terms of discussions of a possible second wave, given that our numbers here in Nova Scotia have been relatively low, is there any concern that we could get harder hit by a second wave of the virus?
So the concern around the second wave is out there. That's we look at internationally, nationally, people are talking about this. The likelihood, how much we're impacted by that wave. Some of that will depend on now that we recognize a greater possibility of people who have been infected but have no symptoms or very, very mild symptoms, that we may actually have a higher proportion of the population who has been impacted or infected than we have just in our case numbers. And that's why there's discussions underway nationally around doing what's called a serosurvey. So as we develop the ability to actually use blood samples to look for people's level of immunity against this virus, and we're not there yet, but that's been worked at, we could actually do the type of research that could say whatever percentage of the population after wave one is actually developed immunity. Now there's caveats around that. We're not for sure. We don't know for sure how long that immunity lasts, etc., with this new virus. But that would give us a much stronger ability to say, well, how strong are we likely to be impacted by any subsequent waves of COVID-19? So it's far too early to make guesses around how impactful that wave 2 might be. We have to be prepared it's likely to come, and the type of research that I talked about in the coming few months will help us with firmer answers.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang. Regarding the 57% of people who have recovered from the virus, how does this compare with the national rate of recovery? Is this where you expected to be at this point?
I frankly haven't seen any data that, or it may be there. I haven't had time to go looking for it. How we compare to other provinces. My strong guess would be that we're in the range of where we would expect to be, knowing that some provinces are further ahead in in how things play out in their jurisdiction, we know that the vast majority of people will ultimately recover from this disease, and so they may have a higher percentage who have recovered simply because they're maybe a few weeks ahead of us.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. Most of the deaths and many of the confirmed cases have been in nursing homes, mostly at one facility, Northwood. Is there a danger that will give those of us who don't live in long-term care a false sense of security, that it seems to be happening in one place and that's it?
So I hope it doesn't. I mean, that's why we continue to say that's not the only place where we have COVID activity. We have, community-based cases. While the majority of them are centered in the HRM area, there are sporadic cases in communities across the province. So I certainly hope people understand that COVID-19 is an issue across the whole province, and that we all need to be careful. And if you have the symptoms, get tested and take the preventive measures that we all need to do, because even if one community lets their guard down, or one area of the province lets their guard down, we still have a lot of mobility across the province, and there's a real risk of an area that lets their guard down, that the virus then takes hold, and we have long-term care facilities. We have vulnerable people in all our communities, and we're putting them at risk if any one region thinks that they're kind of can kind of relax and not pay strong attention to the risks from COVID-19.
Next, we'll go to Lindsay Armstrong from all Nova Scotia. Go ahead, Lindsay.
Thank you. For the Premier, in regards to the municipality loan program, why did you decide to make these loans interest-bearing, taking into consideration it's ultimately the taxpayers of these municipalities that will have to bear the burden?
Well, it's a deferral issue that the municipalities would budget for. It would have been a line item for them. They worked with our partners, with the municipalities, and it was the appropriate level. I would remind you the reason we're doing the borrowing is because the interest rates outside of us would have been higher. So they're benefiting from the provincial interest rate.
Go ahead, Lindsay, with your follow-up.
Thank you. For Dr. Strang, you mentioned today that we're operating well below the testing capacity. Curious why that is, and you said other kinds of work could happen in the lab to better understand the Nova Scotia outbreak. What type of work would that include?
So I think part of it is a weekend phenomena, that we tend to have dips in testing over the weekend. We've also, as I said, we were not testing as many people as part of the Northwood outbreak, but we still have to be out there. And the third piece is, as we get out of flu season, there's fewer and fewer people with the symptoms that could be influenza, could be COVID, but there's less people with the type of symptoms that we would say you need to come forward and be tested. So there's a number of factors out there that could lead to a lower testing, but we have a lot of capacity. So we're beginning some conversations around, for instance, we have homeless populations here in HRM. We have a case in one of the shelters, and we're testing a lot of people around that. But we're also talking about the need, and we're actively doing this, testing all the homeless population starting in Halifax. But we have also shelters in other parts of the province, and these are very vulnerable populations. So that's just an example of how we're looking at it. We expand our testing. There are other ways that we could look at using our testing to help answer. I talked just previously, the previous question, about a sero survey, but we could also just take a community or take a large workplace and just say we're going to test everybody. Not so much to detect whether the individuals have disease, but that would help us answer. If 15 or 20% of people in a large workplace test positive, that tells us something about the level of community spread. I'm just saying we have no firm plans on that, but I'm saying that's the type of thinking and discussions we're starting to have. How do we make sure that we're continue to use our well-developed and strong lab capacity to help respond to the COVID-19 and individual cases, but other ways that we could potentially use testing to give us other pieces of evidence that inform our ongoing response plan and our ability as how we may lift restrictions.
Next, we'll go to Ed Halverson from QCCR in Liverpool.
Yes, my question's for the Premier. Premier, could you give us an idea of what the conversations were had with municipalities that led to the creation of the municipal loan program?
So I wasn't involved in those. It would have been Minister Porter. Many of them were looking for an opportunity to defer property taxes for a number of months. Some municipalities have greater financial wherewithal to withstand that. Some have higher capacity to go to lending institutions to acquire money to hold them over. We wanted to do something collectively. I want to thank the UNSM, Pam Mood, who's leading that, express my appreciation to her and to all of her colleagues across the province to working with Minister Porter to be able to put together a program that made sense for them and made sense for us, and quite at the end of the day was a fair thing for their property tax owners in our province.
Go ahead, Ed, with your follow-up.
Yes, thank you. I was also wondering if you could perhaps give us some insight on what the criteria would be for approving those loans.
So that'll be the municipality who will determine rent deferral. It would be like all of our rent deferrals, quite frankly. If you can afford to pay. The reality of this is not going to, your municipal taxes are not being forgiven; they're being deferred, which means you'll have to pay them at a later date. So if you can afford to pay them today, then please pay them. And the amount that each municipality will ask for or withdraw down on will depend on how many of their property tax owners actually accept the deferral for a period of time.
Next, we'll go to Katie Hartai from News 95.7. Go ahead, Katie.
Dr. Strang, how many of the 15 cases announced today are Northwood residents?
So we know at least 4 of those are. There's probably more. As I've explained there, we have a different time, the timing. So my epidemiologist, they get information directly from the lab, and it's about a 5 a.m. cutoff as then they produce reports for the day. The cutoff for the Northwood data comes a number of hours later, so we can't completely match it up. But we know at least 4 of the cases from today, and probably more of those are of the total of 15 are from Northwood.
Go ahead, Katie, with your follow-up.
Researchers across the planet are racing to find a vaccine for COVID-19. A new poll is suggesting that Canadians are divided on whether or not getting it should be mandatory or voluntary. Is Nova Scotia considering making the future vaccine mandatory, or where does it sit on that?
So we haven't even had those conversations. We know that a vaccine for this disease is months, if not years away. And when we actually get a vaccine, we may actually, it may actually be that we've had enough infection go around and enough waves that we don't no longer need the vaccine. So it's far premature to be asking or trying to answer questions like that.
Next, we'll go to Yvette D'Entremont, Halifax Examiner.
Yes, good afternoon. My first question is for Dr. Strang. With regard to the residents of the Halifax homeless shelter who were provided hotel rooms last week after one resident had tested positive, you mentioned on Friday there's quite possibly COVID virus circulating through that population. So I'm wondering if any consideration is being given to also moving other homeless shelter residents to hotels. And further to that, would you be able to elaborate on the testing regime that is currently in place at homeless shelters?
So we have, and I'd like to thank, with very good support from the Mobile Outreach Street Health Clinic, which has been doing a lot of this testing. We have, first of all, we started, as we always do, with the case and then their known contacts, as well as that included residents and staff in a couple of shelters. But because there's lots of movement of people between shelters, we have expanded that testing. So now we're in the process of testing residents and staff throughout the HRM area in terms of all the shelters. And so far, fortunately, as of today, we have had no positives come back, but we still have a number. There's a number of individuals we continue to test and wait for their results. The first step has been to get hotel space for both the cases who need to then be isolated until they can be considered to be no longer children infectious to others and not able to spread the disease. And we also need to quarantine their contacts because these individuals, because of the way they have to live, they're in lots of contact with each other. And so anybody who's known to be exposed, we want them in a more strict quarantine. So if they do become infected and start to be able to spread the virus, their ability to spread to others is limited. We do know that at the end of the day that shelter environments are a significant risk for spreading any kind of infectious disease because of close quarters and really the very significant challenges around maintaining things like social distancing and hand washing. And there are certainly discussions going on about how we could do a better job supporting the homeless population in general, minimizing their risk of being exposed to COVID-19.
Go ahead with your follow-up, Yvette.
This is for the Premier. I'm just wondering, Premier, have the mass murders of April 18th, 19th been referred to the Domestic Violence Death Review Committee? And if not, why not?
I'm sorry, I'm not sure what you're referring to. Did you say the letters?
Sorry, the Canadian Domestic Homicide Prevention Initiative has a domestic death review committee. It's essentially a multidisciplinary advisory committee of experts that review domestic violence-related deaths with the underlying objective of preventing them in the future.
Well, there's been ongoing work through both with Minister Regan and Department of Community Status of Women and with Minister Fury, with the Department of Justice, dealing with this very serious issue in our province. It is unacceptable. I've said this many times, that women and children are feeling afraid and frightened and afraid for their own lives in their own homes. For many of us is the sanctuary where we find comfort and love and caring. But far too many Nova Scotians do not feel that way. And both of those departments are working hard, not only inside of our province, but with our national partners to ensure that we can continue to shine light on this at the same time as we stand up and predominantly tell our sons violence is not acceptable in any way, and that we as a society have had enough, and we're not going to tolerate it anymore, and put in place public policy and protocols to ensure that we deal with this hideous crime.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. I want to take a moment to talk to teachers, parents, and students, if I may. I'm getting a lot of reports of what a wonderful job you've been doing with your at-home learning. Congratulations and thank you for all the work you're doing in such difficult circumstances. I know at the beginning this seemed daunting. Even our teachers had to learn a new way to teach. And parents, many of whom are working from home, also had to turn to their kitchen table as a classroom. Education, even not in the classroom, is very important for our province, for our children. We want to continue to be a smart province. Our future depends on it. And the way all of you have embraced at-home learning is inspiring, and I'm so proud of all of you. As hard as it may be, I think you can keep doing it for another 3 weeks. Then we will assess. So to all of the students out there, be good to your parents, listen to your teachers, and keep on learning, please.